Okay, so we're on lab 11. So if you're following along with me, I'm on the special test chart now. So that the first special test that we're going to be going over is the palpation test. So for this one, we're going to be looking for TMJ, so that temporal mandibular joint dysfunction. So what's happening is, so our TMJ, like I showed you guys earlier, is going to be that top of the jaw, that joint that opens and closes your mouth. So if this joint has a dysfunction, you're going to either see a lot of pain with movement, especially with chewing, or like popping, clicking, or the jaw kind of moving out of place. So for this test, the first thing that you're going to do is put gloves on, because you're going to end up putting your pinkies in someone's ears. So what we're doing here, so you're going to stick the pinkies in their ears, and you're going to be kind of pulling anteriorly, so we're placing pressure on the TMJ joint, since the TMJ sits right in front of the ears. So we're applying that anterior force, and then they're going to open and close their jaw, and then a positive test would either be pain for the patient, or you'll feel some kind of clicking and popping. So, ready? Yes. Okay, so I'm putting my pinkies in your ears, I'm doing that anterior force, and then we're instructing them to open and close their jaw. Ow! Sorry. Okay, so that's the palpation test. Okay, so then the next one is the mandibular fracture test. So if you can recall from the palpations from earlier, the mandible is the bottom jaw. So if we're having a fracture in this area, we're not going to be, or the patient will not be able to keep a clenched jaw, because the fracture isn't allowing the teeth to stay together. So what we're doing here is we're going to have a tongue depressor, and we're going to stick that on one side of the mouth. So if we think the fracture is on the right side, then we'll test the right side, but we obviously have to test bilaterally. Okay, so right now I'm going to suspect that my patient here has a fracture on her right side. So I'm going to stick the tongue depressor in underneath her right side teeth, and she's going to bite down, and I'm going to try to pull it out. Okay, so open your mouth, bite down as hard as you can, and I'm going to try to pull it forward while she continues to bite down. Relax. So that's the mandibular fracture test. So for a positive here, if she weren't able to hold that tongue depressor in her mouth, that would be a positive sign of a mandibular fracture. Okay, so then the third and last test here for the face is the maxillary fracture test. So the maxilla, that's going to be where our top teeth sit. So if there's a maxillary fracture, a lot of times you might see like bleeding in between the teeth or in the gums. So what we're doing here is we're actually going to grab the teeth on that top row of teeth. We're going to try to pull it forward, and we're going to look for any type of shifting or abnormal movement that might occur. So if you want to come a little bit closer. Okay, so open your mouth, and I'm going to grab those front teeth, and I'm pulling forward. So I'm kind of like trying to pull them out, almost like pulling them anteriorly. And so again, if I felt any shifting or any sort of movement there, then that would be a positive sign.